So I'm going to be reading to you the important parts of the reading Severe Adverse Reactions to Dental Local Anesthetics, Prolonged Mandibular and Lingual Nerve Anesthesia. So in the introduction of this paper, they said, a different group of adverse reactions to local anesthetic injection is when the loss of sensation is prolonged. This may be temporary, where after a few days, weeks, or months, sensation returns, or it may be permanent. This mainly involves lingual or mandibular nerves, or both. Prolonged anesthesia following infiltration of the maxillary nerves is rare. Anatomically, the lingual nerve is at greater risk than the mandibular nerve from a block injection. In the standard mouth-open position for a mandibular block, the lingual nerve is stretched quite tight and is just a few millimeters beneath the mucosal surface. For this reason, lingual nerve injury is more common than mandibular nerve injury when caused by local anesthetic injections. The precise mechanisms of nerve injury from local anesthetic injection are controversial. The traditional concept is a direct injury by the needle traumatizing the nerve. This, however, is unlikely as the diameter of the mandibular nerve is up to 3 millimeters and for lingual nerves up to 2 millimeters, but the diameter of the largest injection needle is less than 0.5 millimeters. The potential danger of damage by the needle could be increased by the bevel being bent as it contacts the bone. This needle damage has been shown to occur in up to 80% of injections, with up to 2/3 of the bevel being hooked outwards. This could potentially transect multiple nerve fibers or even a fascicle when the needle is withdrawn. However, it would not feasibly transect the whole nerve. It has been suggested that an important clinical sign of nerve injury during a block is an electric shock type sensation at the time of injection. When the adverse reaction of prolonged anesthesia occurs, invariably the patient feels they have been wounded. This ranges from minor regret to considering medico-legal action. Usually, the patient feels that the cost of any referral or treatment should be borne by the practitioner who gave the block. It is also easy for the practitioner to further inflame the situation by unguarded comments or promises that it will get better soon. Once a patient reports to the treating dentist that they are still suffering from anesthesia following LA injection, the patient must be examined for the distribution of the sensory loss and other signs. The patient should be regularly followed up until resolution. It is sound defensive practice to offer referral to a specialist with an interest and experience in nerve injuries.